We are winding down Unit 2. What a doozy. So, before I even start talking here, I want you to take a moment, collect yourself. Do not proceed. We're timing this course. I'm not going to give people, I think I'm going to trial it with a month. Because sometimes if you have too much time, you kind of lose focus. Where life is busy, typically, as you know, the class is 3 days or sometimes 4 days. But I make accommodations for your life and stopping and repeating. I want people to be able to repeat, and really just, when I say repeat, I mean replay, and really just go at their own pace. So as we're winding down Unit 2, I want to take a breather and spot check and make sure that you're really understanding. Make sure that you understand before you proceed, and that's going to reduce the amount of times that you have to study, and you'll be prepped to take your tests. Okay? So make sure you have full understanding. So let's finish this. We've been talking a lot about giving medications. That's obviously why the entire course was designed, so you could administer safely. Now we're getting into liquid meds. I'm going to post a quick little video watching me pour medication, so I won't spend too much time on this slide. Basically, you have to be eye level, med cup. I'll really have the med cup there so you could see it, locate the correct measurement. With the liquid med, you have to have the plastic cup, not the paper cup with the markings on it, so that you know 5 mLs, 10 mLs, and we're talking about milliliters. And you have to pour slowly so you don't over pour. That's just going to take some practice. Usually in class, I have people pour and practice, and we all have a good laugh because people pour too much. And you're just going to have to practice that. Um, on your own, you could probably just pour, take anything you have and pour into a med cup. The med cups you can get anywhere, and certainly in the homes, you could practice on one med cup. You don't have to waste tons of cups. When you go to your program, just take one, and people could just go around practicing. But I'll post a little video on that. These are oral syringes. A lot of people with children have certainly seen these with good old Tylenol. Um, they have the markings on this. In our program, well, MAP can be used in DCF. So if you're with the youth, you'll see them. And one thing that I do want to point out here, the markings. Let's talk about conversion. So the oral syringes are pretty simple to use. Right now, focus on these two, and we'll talk about conversions that you could see here. So you could see 5 mLs, milliliters equals 1 teaspoon, right? So 5 mLs, 5 ml, because a doctor a lot of times will write in teaspoon equals 1 teaspoon. And a lot of homes have this posted. Again, it's not the business of keeping things in your mind. A lot of places, I know my programs, I have it posted if you don't already know. So 5 milliliters equals 1 teaspoon, and 15 milliliters equals 1 tablespoon. Now, the big thing here, I don't think I've seen a test question on it, but just so you know, is that just because teaspoon, tablespoon does not mean you're taking your kind of kitchen utensils and measuring this, okay? So I put 5 ml equals 1 teaspoon TSP, that's an S, and 15 mLs equals 1 tablespoon TBS, okay? And it's usually in cap locks. So you're not taking your spoon that you were just eating soup with and measuring this. You're always going to measure it in a medicine cup or in a syringe or a different thing that we're about to show you. So that's why you see the 5 here, okay? And the 10 is 2 teaspoons, okay? And if it went to 15, it would say tablespoon. All right. This marking, this decimal, the med that I typically see it with, you see the most it is 1 ml. Those are really small dosing. The only thing I can think of is the liquid simethicone for gas, and I've even seen that for adults. You have a dropper when it's really tiny as well. You have a dosing spoon that goes to 10, and it's for mostly for kids, this one, so they could just, drink it. They need help. And you have the measurements on there. So notice none of these pictures are a spoon, okay? You're always supposed to use some measuring device. Now, let's spend some time on this slide. You already did the med math of dose D over H equals amount. So you're like, where is this volume coming from? So because we're dealing with liquid, right? The only thing that comes up to mind is if you're having a beer and it says what percentage of alcohol is in it. But say, for example, you have a medication, the doctor will always order the dose, just as we know, even with the tablet form. But in the liquid form, because it's a liquid, the pharmacy has to they'll send you a bottle of medication, and they have to tell you what the concentration is. Meaning the concentration means for example, for every 10 mLs you pour, there is 100 milligrams of the medication in that liquid. Okay, that's called a concentration, and that's really important to know. So I have to tell you for every amount how much medication is in that. Okay, if you were mixing, I'm trying to think of an example. Like if you're making juice, powdered juice, Kool-Aid, whatever the case may be, you have to know how much powder or how much juice to put in the water, okay? You need the concentration. So when you have the concentration, the formula is still the same. Example, HCP orders 100 milligrams. This is the dose. That has not changed. I'm going to put a D for dose, right? That hasn't changed. Pharmacy sends liquid medication with a concentration, meaning 100 milligrams per 5 mLs. So this is what you have. Okay, the H is what you have. You have 100 milligrams. And this is what's new to you. I'm going to highlight it. The 5 mLs. So every 5 mLs is 100 milligrams. That is your V for volume. So the formula is dose divided by H, what you have, times the volume. Okay, so in front of you, the concentration is the H and the V. Okay, so doctor orders 100 milligrams of whatever medication. Whatever the medication is, doesn't matter to us at this point. We're just doing the math. Doctor orders 100 milligrams. You divide it by what you have, 100 milligrams. Okay, and then you would multiply it times the volume, which is 5 mLs. So that's what your equation looks like. And the test questions that I've seen for med math have been more so for pills. I don't think that I've seen a volume, but I might be wrong. 100 divided by 100, remember the milligrams cross out, so you have 1. 1 times 5 mLs, 1 times 5 milliliters equals 5 mLs. You see that? So you are going to administer 5 mLs. So that's all. So the liquid math is adding another layer, but that's it, the layer of the volume. Okay? And so we do that in transcription, but I don't know that I've seen a lot of test questions on the computer-based tests, but we do give a lot of liquids. Antibiotics come in a liquid, so you have to know I'm trying to think what else. There's some pain meds that come in liquids. All right. Some meds for gas or for constipation. All right. So you will have liquid meds and you have to be familiar. Now, let's talk about medication refusal, but we have been talking about it, but this is the formal uh, slide. So remember I said a person can't say no and you just toss the pills. They have to say refused 3 times in a row, 15 to 20 minutes in between. Meaning you offer the pills, they refuse, and you do whatever necessary. Like if they're having a behavior, you try to calm them down. If it's explanation they need or water, whatever the case may be, you offer it a second time. They refuse, you take some sort of intervention. On the third time is when you could document refusal. Now let's bring it back to your MAP consultant. Remember going back from unit 1. When the MAP consultant that you would call, remember there's 3 types of MAP consultants: the healthcare provider, the nurse, which I am for my facility, and the pharmacist. For refusal, you would call the healthcare provider, the person who prescribed the medication, and that's a test question. Okay, now here the slide's also letting you know, and I spoke to this before, that it's not just if they say, oh no, I don't want to take it. If they threw up, vomiting, intentional or intentional, within half hour has to be a refusal, right? Because it's not in their system. If they spit it out and you later found it on the floor in the bed, that's a refusal. That's a way for people to know, hey guys, this medication is not in their system. It's not doing the required effect. Now, the bulk of my nursing has been in oncology, and we have some pills that are oral. And so I'm speaking to this vomiting. When someone would throw up, especially after giving them a chemo pill, we would have to sift through the emesis, the throw up, to see if that chemo pill came up, because it's very important. I'm just giving you an example to know if you have to give them another dose or what you have to do. But if somebody refuses, you call the HCP. Now, the rule on refusal, you will get tested on. Okay, so here's the rule: the 3 times, 15 to 20 minutes. Contact the prescriber, HCP, for recommendations, notify your supervisor, and document. So let's talk about how you document. This is page 144 is where it starts in your big book. 144, 145 is what we're on. This is now just going over everything we discussed. On the med sheet, you're going to document, and here it's going to look like a med administration. If you don't remember the med administration, you could go back to the details of that video, the document, how to document on a med sheet and on a count sheet. But instead of just being your initials, you're still going to initial there, but you're going to circle. Okay, and then you're going to go in the back progress note. So remember when we went over your med book. So here's an example. All right, you're going to, and we're in your responsibilities in action book. This content started on page 144. It's 144 and I believe to 146. This is just a little snippet of your med sheet. Remember good old clonazepam, that's what we've been doing. So JS here, you see the initials, but then JS circled it. Okay, so you don't see the entire med sheet, but they're just giving you the little snippet so you can see. And then on the progress note, remember when we went over your med book and your count book, the progress note, they wrote a note, February 3rd, YR 8:30, Tanisha refused her morning clonazepam 1 milligram. I attempted to administer it 3 times. Dr. Lee was notified. He recommended to skip this dose and to administer the next dose when it's due. Linda White's supervisor also notified. And this line here, after the person writes, you see this line going across, my hand's not steady, and then Jenna Sherman signing it. That's because you don't want anyone to come behind you and write anything. So when you're done speaking, if there's space between what you are writing and your signature, you do a line across. And remember, you're always documenting in ink and no one can come behind you. So remember, this progress note is after the med sheet. So remember when we reviewed it, I said sometimes you use the progress note, sometimes you don't. Okay, and that's how you would document a med refusal. So you are done with unit